Hello everybody, this is Dr. Aaron Seaton with the Chiropractic Place. Today's video is about how chiropractic works. We get a lot of patients who come in, get care, and still have some questions about how is this really working? I feel these differences in my body. I can clearly see the difference. How is this actually working? So I wanted to kind of clarify with people about what is actually happening. And one of the misconceptions in the public is that there are bones that are like out of place and we put them back in, and after you get that adjustment and now that the bone is back in, I need to be really, really careful so it doesn't go out of place again. That's not what happens. Like when you take an x-ray of somebody before an adjustment and take an x-ray of somebody after their adjustment, their x-rays are rarely going to be any different than they were. And so what actually happens when chiropractors make an adjustment is we are restoring motion to a joint that is fixated. It's not able to move as much as it needs to. So we restore that motion and allow it to move better. And while we do that, that takes pressure off of the nerves in the area, allowing the brain and the body to communicate much more effectively. The other thing that happens at the joint level is you have less pain, improved range of motion. People tend to feel more energy. We've even heard in patients in the first week of care that they're sleeping better. There are a number of all these other side benefits that tend to happen with chiropractic care, which are amazing. But one of the things is try not to have that in your mind that a bone is out of place and I'm putting it back into place. That's not what it is. The joints are either moving or not moving. And when we find joints that are not moving properly at their full potential, when we make a chiropractic adjustment, we are restoring motion to that joint and getting it moving properly again so that your body can begin to benefit from the nerves flowing properly, more range of motion, all of these other things. So typically if you've not been under care in a while, or it's been, say, your whole life, you've never had an adjustment, when we start chiropractic care with patients, one visit doesn't magically correct years and years of neglect on these things. So what we typically do is we do a course of care with our patients and doing a series of chiropractic adjustments, a series of visits to restore that proper motion, to get everything to heal and get it to be functioning at its very best. And that can take a little bit of time, but if you're doing your chiropractic care in conjunction with stretches or home exercise, whatever it is we recommend, you're going to see a much better, improved quality of life with chiropractic care. I'm Dr. Aaron Seaton with the Chiropractic Place.